muscle wasting disease like DMD, we put in a smaller copy of the DMD gene, right, into
Yeah.
that AAV like vector and deliver it. But and we'll talk about this gene therapy later, but there's always been these problems, right? With a lot of the AAV, it's like a blunt instrument, right?
Mhm.
It's kind of like, I hate to use this term, but like bombers, like carpet bombing, just throwing bombs, because
Yeah.
most of these AAVs go to the liver, right? So you can't really send it to the tissue of your choice, and you have to
Right.
deliver it in huge amounts. You said there were
Right.
30 trillion cells in the human body. I think Sarepta delivers something like 3 or 4 trillion copies of their
Yeah.
AAV vector, because
Mhm.
muscle makes up such a big part, right?
Yeah.
So that's been part of the issue with
Yeah.
gene therapy, is this very blunt force approach, right?
Exactly. Yeah. So the thing is, like you said, there is several off-target effects, especially of these like sort of broader therapies that use this vector to deliver the functioning copy of the gene. And one of those is liver toxicity. And like you said, we have to use so many copy or so many of these little viral particles. And sometimes the body can perceive that as a threat, right? So you have people that are sick, their immune system should be intact. And so sometimes that can actually be overactivated by this assault, right? Like, so imagine it's just like an infection, maybe just even like a cold infection. But if you have those like tremendous amount of viral particles, it can really trigger the immune system to be overactivated, and then it can basically shut down or have cause other issues in the body. And so what they do, I think Sarepta, even though they had just recently had 2 deaths associated with liver toxicity, I think they put people on sirolimus. So they basically immunosuppress the patients before giving them this therapy to basically prevent these overactivations of immune system.